Okay, Cesar also asked, are there any invasive procedures, uses of conventional medicine that could be avoided by utilizing chiropractic care? And these are great questions. And yes, the answer is yes. One of the things that the chiropractic profession does is give a conservative approach, a natural approach to a lot of these problems that people wind up getting hooked on medications for. Medications, if you look at that ebook that I wrote, there are all these different modes of action of these medications. They make the pain nerve endings less sensitive. They block the pain at the brain. They have a lot of different modes, but none of them approach or correct these biomechanical problems I'm talking about. None of them are going to get those red bees to move like those brown bees. None of them are going to get the pressure released off the joint, and the inflammation out of the disc, so that the body can then function normally, so that this natural pain reaction to damage, to injury, to dysfunction is corrected. That none of those medications will do that. And in fact, there's an opioid epidemic. And one of the reasons is I know people that happened to. They started out normal, living normal lives, and ended up as drug addicts because they couldn't get pain relief, because these pain nerve endings, they keep sending signals. Nothing's happening in the area where the problem is. Nothing's happening to release that, to relieve it. So the signals keep coming. So you need to keep muting it with drugs, and you need to take stronger and stronger drugs. You need to take more of the drugs. And then when the doctors refuse to give you any more, a lot of these people go out on the street. Heroin's a lot cheaper than Oxycontin. So it becomes a really vicious cycle. So we're able to help people in that case. And then the other thing that goes on is surgery. You go through this protocol, see your doctor gives you medication doesn't work, you go to orthopedist, you go to the physical therapy, nothing works, you wind up in pain management, and then either you wind up hooked on drugs, or you get sent back to the surgeon, and now you've got surgery. Well, surgery sometimes is a godsend. It can really relieve a problem. And sometimes I've sent people over the years, not all that often, but I have sent people to surgeons, usually a neurosurgeon. I have a very good neurosurgeon who practices not too far from my office, and he's excellent, and I will send people to him, at least for an evaluation, and sometimes for surgery if that's what's necessary, because chiropractic can't cure everything, and sometimes these problems are beyond the scope of what we can actually help with. But that being said, surgery sometimes just doesn't work out. I've seen some really sad cases of people who've had 2 or 3 surgeries, and surgeons won't touch them anymore because the surgeries have failed. In fact, they're worse than they were before the surgery, and that's always a risk that you take when you're getting surgery. A surgeon is cutting into your body, taking parts out, and putting screws in a lot of times, and plates, and things can go wrong with surgery. So surgery is absolutely the last resort. I had a patient not too long ago. She was in a very severe car accident. She had been to a chiropractor. The chiropractor took care of her for about a year, but she wasn't getting better. He had x-rays. He would send her out for an MRI. The MRI showed a bulging disc that was pinching a nerve. She went to a neurosurgeon had an EMG done. It showed that there was actual interference with the nerve conduction, and they had her scheduled for surgery. And they were going to do a rather radical surgery because they determined that there was an instability in her neck, and they were going to put plates and screws and bolts, whatever it is that they do. So that frightened her. Luckily, her cousin was one of my patients, so she sent her to me. She came to me as a last resort. A lot of people come to the chiropractor as a last resort. And I did an exam, because I know these other techniques, these extremity techniques, and I did a lot of studying on that. I looked at it, I said, yeah, I think you do have a problem in your neck with that disc and everything, but I don't think that's where all this pain's coming from. I think you also have a problem in the joint in your shoulder and your elbow and your wrist. You were holding on to the steering wheel when it happened. And there's also a problem in the muscle here, and you have what are called trigger points, which are areas of the muscle that are hyperactive and they cause a lot of pain. So I said, let's give it a try. So I did what I do, and sure enough, within 3 or 4 months, her pain was to the point where she knew she wasn't going to need surgery, and I think it took about 6 months, and the pain was about 90% gone. It would come back now and again because it was permanent damage done to her neck from the car accident, but saved her from surgery. So it was great. She had everybody in her family, everybody she knew she was sending to me. But yes, this is the most gratifying part of being a chiropractor. Helping people get well naturally, getting to the cause of the problem, biomechanical cause of the problem, correcting it, and relieving pain, giving a person better function in their lives. A lot of times people will come to me and say, the pain's gone, but I didn't realize how stiff I was. I didn't realize how tired I was. I didn't realize how cloudy my thinking was. And now that I've been getting chiropractic adjustments, I'm functioning at a much higher level. And that is the beauty of that's what I've been doing for 38 years. That's what's going to keep me going. I don't have another 38 years, but if I did, I would keep doing this.